And now to some pandemic news out of Washington. 3 fully vaccinated U.S. senators have tested positive for COVID and are reporting mild symptoms. This as some hospitals around the country are entering full crisis mode. Marcus Moore is in Dallas with the latest.
This morning, COVID hospitalizations hitting their highest point since January. Now nearly 93,000 patients seeking care. The crisis deepening in the South. In Alabama, ICUs are 100% full.
We're experiencing wait times in the emergency room like we've never seen. They are waiting for hours and sometimes more than 24 hours in the emergency department so that they can move upstairs to get a bed.
The number of children hospitalized with COVID now at its highest point since the pandemic began. And images like these are emerging. A Navy medical support team arriving to assist Louisiana hospitals where teams are overworked and understaffed. But as help arrives to deal with the influx of COVID patients, mask battles are erupting. This chaotic meeting in front of a statewide Board of Education in Louisiana cut short.
Madam President, yes. Due to the fact that the audience has ignored the request to wear masks, I move that we adjourn the meeting.
The motion passes.
An ER physician pleading with parents at a school board meeting in Alabama.
If you're not scared of COVID, you need to be scared of your hospital system collapsing, because right now I can't take care of your families the way we need to take care of your families.
In Hillsborough County, Florida, where more than 12,000 students and staff were quarantined Thursday, the school board voting on a 30-day mask mandate, despite the governor's ban.
If it saves one life, 10 hospitalizations, isn't that the least that we can do?
And in Texas, where hospital workers are desperate.
Today was probably the most emotionally, mentally, and physically draining shift I've worked.
Overnight, Texas dropping its enforcement of Governor Abbott's ban on school mask mandates after a Supreme Court ruling upheld one district's restraining order. A big win for dozens of major school districts in the state, which have been defying the governor, and others like Texas City, which had attempted to get around the rule by making masks part of the school uniform.
Mask are child abuse!
I understand that people want to make choices for themselves, but we also have a responsibility as a district to take care of our children when they are in our care.
So, Diane, this morning, not only are cases on the rise, but also hospitalizations. And right now, the ICUs in 5 southern states are above 90% capacity, and that's what's so concerning for medical officials. And a quick word, Diane, on the vaccinations. The White House says that more than 1 million were administered on Thursday, and that greater than half of those doses were first-time shots. So the race to vaccinate is still on. Diane.
All right, Marcus Moore in Dallas, Texas. Thanks, Marcus. And in addition to full ICUs, the HHS says Alabama is also facing a 59% increase in hospitalizations in the past 2 weeks and an average of more than 3,600 cases per day. According to the CDC, only 45% of adults are fully vaccinated in the state. Let's bring in Vice President for Clinical Support Services at UAB Hospital, Dr. Sarah Nafziger, for more on this. Dr. Nafziger, thanks for being here. I know it's a really busy time. So walk me through this. With ICUs in Alabama at 100% capacity and hospitalizations increasing, what happens now?
You know, that's a scary question. Our hospital remains full at baseline, but now that we have this increase in surge of COVID patients, many of whom are requiring critical care, it's really become a dire situation. We have very few beds available for COVID care right now. And, you know, at baseline, our beds are in high demand, but right now we're really feeling that crunch, not only for COVID care, but it's stretching us thin so that we are having difficulty providing care for other things like heart attacks, strokes, and trauma patients. So right now we're really in dire circumstances, and unfortunately the forecast is that it's going to get worse before it gets better.
Now, the number of children hospitalized with COVID is now at its highest point since the pandemic started. And Greene County schools are switching to remote for at least the next 2 weeks, they say, out of an abundance of caution. Do you think other schools need to follow them in doing that?
You know, I haven't looked at the data on the number of cases in schools this week, but I imagine those numbers are going to skyrocket because we know that a lot of schools in our state have decided that masking is not required. And so I'm very concerned that we're going to see a lot of children infected and those numbers just continue to rise. Now, if that happens, I think the schools will not have a choice. They will have to go to a virtual model because there won't be enough children or teachers in the classroom. So very concerned about what we're seeing going on in our schools right now is we know that, children become infected and they can carry disease around and transmit it to their family members as well. So that's just going to further drive up hospitalizations.
Now, the CDC says only 45% of adults in Alabama are fully vaccinated. And now an Alabama doctor is getting a lot of attention for posting a sign on his door saying, quote, "Don't come in for medical treatment if you are unvaccinated." What's your reaction to that?
At UAB, we care for everyone, whether they're vaccinated or not. That's just our standard of care. We're going to care for everyone. We're going to take care of them and do our very best to provide that care. While we're very disappointed that a lot of Alabamians have chosen not to be vaccinated, we're encouraging them to be vaccinated, but we're still going to care for them if they show up. Unfortunately, right now, though, our resources are very strapped and limited. We have a lot of patients to care for who have COVID, and that's limiting our ability to provide other services. So it's really impacting not only COVID care, but care for other things.
So what resources do Alabama hospitals and healthcare workers need right now?
We need more staff. That's really the thing that's limiting us right now. In the previous surge, our staff was a little more well rested, but now, we've been at this for 18 months and we're exhausted. So, really staffing is one of our major concerns. We have some space available right now. We're good on PPE or personal protective equipment, but staffing right now is our biggest concern. And, you can't just bring staff in and magically make them appear. Those are human resources, and they require a lot of skills, and they need to learn to work in your work environment. So it's something that is a big challenge for us right now.
And Dr. Navseger, what is it about this surge that you think that you are seeing on the front lines that you feel like people who aren't getting?
Right now we've been able to provide most of the care that people need. But what we're seeing right now is that a lot of our surgeries for things where we would bring someone in, we call it elective, but a lot of these are really essential surgeries for things like cancer, elective living-related donor kidney transplants, things like that. Things where people would come into the hospital to have a procedure done that would require an overnight admission. We're having to delay a lot of those procedures, so people are just not getting that care. Now, in addition to that, we receive a lot of requests for transfers for things like snake bites, pregnant women with complications, people with heart disease and other heart conditions, and a lot of those transfers that normally we would accept without hesitation, we have not been able to accept from other hospitals, and those patients are having to receive care at a place where, maybe that hospital might not have the same resources available. So those are the kind of things that people are foregoing right now, the kind of care that people are not getting. And is it alarming to me? Absolutely. Because my thought is, what if that's my child that's in a car accident and there's no EMS resources, there's no hospital resources available to care for them? If people are not afraid of COVID, if they're not concerned about it, maybe this will get their attention, because this is a real crisis. This is not a drill.
It sure is. Dr. Sarah Navseger, we appreciate your time today. Good luck to you. Thank you.
Thank you so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.